Good day, I'm LAIKA Dugay. I'm a fourth-year medical student and I am from Kalinga. First question, so that's one clinical skill that I've learned probably is a good communication skill because from that we are already able to diagnose a patient based on the history of that we've managed to gather, and having a good communication skill is already a big diagnosing our patients. Then second question, which department challenged you the most and what did you take away from that experience? For me, that would be pedia, mostly because our patients can't speak and they cannot express how they feel. So they were not able to tell us where exactly hurts or what exactly is the problem. So definitely it is the one that challenged me the most because of those criterias. Can you share a story of a patient interaction that really touched you or made a lasting impact? Probably there is one time that we went community rotation outside of the R2TMC, and one father had his two daughters who are suffering from UTI. Both the children, 5-year-old or 6-year-old, they are able to experience the pain for around 5 days, difficulty in urinating. And when I was able to ask the father why he was not able to take his daughters to the hospital, he said that he was not able to do so because of the lack of financial capacity to bring both of his daughters in the hospital. And I think that is one of the big problem that I have encountered, mostly rotating here, because this is a public hospital. So most of the patients that we encountered came from people who are not financially capacitated to bring their patients here. Even bringing the patients here in the hospital is already a big challenge for most of our patients. So for me, it really breaks my heart because two kids suffering from UTI is already painful for an adult. How much more for a pedia patients? So that was one of the realization and one of the most impactful story for us. And the father cried because upon educating that the hospitals do not ask for fees or medical fees, so that is definitely a big help. The father explained that is definitely a big help for them. So how has your clinical rotation at R2TMC shaped your journey to becoming a doctor? For me, my clinical rotation here at R2TMC is definitely not a walk in the park, but I was able to learn a lot of things, most especially that I came from a non-traditional or traditional pre-med but a non-clinical pre-med BS biology. I have learned a lot of skills and was able to develop that grit, and I think that I have also been developed with the capacity and more confidence in order to help our patients in the future. And the last one is, what keeps you motivated even on the most challenging days of clinical duty? For me, that would be thinking back on why I started getting into medical school in the first place, and that is to help my fellow Filipinos, most especially those who are not able to, or those who are not financially capacitated, like most of the patients here in R2TMC. And when things go hard, definitely that they are one of my biggest inspiration. That's why I'm still here, despite of the hardships that clerkship has brought to us. So if you could say one thing to future PLT students, what would it be? I would say is that you have chosen the right school. Definitely our professors has been guiding us. The PLT staffs has also been very helpful to us, and definitely they will be the one guiding you during your professional journeys in becoming a medical doctor.